Hello, I'm Joe Check, and today I'll be presenting information related to long-term effects of multiple concussions in football players and the steps organizations such as the NFL have taken in order to minimize the risk of further injury. First, in order to understand the long-term effects, we must understand what causes a concussion, the symptoms, and also the treatment of the injury. A concussion is a traumatic brain injury that is caused by a blow to the head or body, a fall, or another injury that jars or shakes the brain inside the skull. A concussion occurs when your brain slams into your skull, as shown here in the picture on the right. Here are some plays that resulted in concussions. Symptoms of concussions include headache, nausea, dizziness and lack of balance, double or fuzzy vision, sensitivity to light and noise, feeling foggy, memory problems, irritability, and sadness. Once an athlete shows signs of a concussion, they should immediately stop any activity, avoid drinking alcohol and using illegal drugs, ice any area that shows signs of swelling, use medicine only as directed by your doctor, and most importantly, rest. Many studies focusing on concussions have been performed over the years, but the research conducted by Bennet Omalu and Chris Nowinski had the biggest impact, resulting in changes to the NFL policy regarding players getting concussed and returning to play after suffering from a concussion. Dr. Bennet Omalu, a forensic and neuropathologist, and Chris Nowinski, a former college football player and WWE wrestler, teamed up in 2007 to prove their hypothesis that there's a link between brain damage resulting from multiple concussions and depression, dementia, and suicide. Nowinski, a standout defensive lineman at Harvard and a wrestler with the WWE, has suffered from at least 6 concussions, the last of which ended his career as a professional wrestler. Nowinski decided to team up with Dr. Omalu after he started experiencing increasing symptoms of depression and thoughts of suicide, to which Nowinski confessed on a 2007 episode of ESPN's Outside the Lines. While working as a medical examiner in Pittsburgh, Dr. Omalu performed autopsies on 2 former NFL players, Mike Webster, who died at age 50 of a heart attack, and Terry Long, who committed suicide at the age of 44 by drinking antifreeze. In both instances, Omalu discovered the former football players' brains were strikingly similar to that of an 80-year-old's with severe dementia. The breakthrough in Omalu's research came in early 2007, months after a former NFL defensive back, Andre Waters, committed suicide. Omalu and Nowinski contacted Waters' family and convinced the family to donate his brain for concussion research. After thorough examination of Waters' brain, Omalu discovered abnormal proteins in the brain which can cause dementia. Between the examination of Waters' brain and speaking to his family, Omalu determined that Andre Waters suffered from dementia symptoms equivalent to that of an 80-year-old man. Waters was only 44 when he decided to end his life. At the end of the study, Omalu concluded that the brain damage sustained from repeated and multiple concussions is sufficient to cause depression and suicidal tendencies. Omalu then coined the term football-induced chronic traumatic encephalopathy, or as he stated in an interview with Outside the Lines, the dementia of football. The NFL initially rejected Omalu's findings and dismissed the research as trivial. However, it is said to be groundbreaking among independent neurologists. After coming under intense scrutiny, the NFL finally made changes to their policies. These policy changes include that a player that suffers from concussion-like symptoms cannot return to the practice or game and must be cleared by an independent neurologist and the team physician before fully returning to competition. Most notably, the NFL has started fining players for helmet-to-helmet hits, during the game, and larger fines are issued to repeat offenders. To conclude, there will always be an inherent risk of serious injury in the sport. But it is vital that we as sport managers create an environment that limits the overall exposures to unnecessary dangers.